As many of you know, in health coaching and beyond, we mix up conversations between the two of us and interviews with people we admire. Our aim is always to help you think well. This week, Tim and I discussed the potential for health coaching in the workplace and its role in generating healthy working lives. This is particularly topical with the growing national and international problem of people being out of work or performing poorly in work due to suboptimal health and wellness. In fact, we think it's so important we've made this the theme of our annual conference this year. Of course, it'll cover a wide range of health coaching and person-centred skills and approaches, but we're really excited this year to draw in both NHS staff and businesses across the region and country. Do see our website for details and how to book a ticket. It's always a great way to connect in person in the lovely Sheffield on May the 6th this summer. But now, on with our conversation. Hi there, Tim. It's good to see you.
Yeah, nice to see you too, Ollie. Yeah.
It's good to be back in the seat, chatting together. You know, we've had a few great interviews the last couple of weeks, haven't we? We've had Tom Williams talking about his parkrun experience in community sport. Then we've had Hussein, really dynamic GP, talking about how he uses health coaching in his GP practice, but with health coaches in group settings and community projects he's doing. There's been some really good episodes there.
It's really good. And again, with Hussein, it's quite, I don't know, it's quite humbling when you have someone who kind of is kind of at the forefront of doing what they're doing, but still kind of willing to learn, take on new stuff and put it into practice and find that it's kind of transformed the way that he works. It's really good to be part of that journey, really. It's quite exciting, I think.
Yeah, it is, isn't it? I think that's a feature of really successful and productive people, is they're open to continue to learn. They're still flexible. They're not closed to ideas. They don't think they've got it all sussed. But that is a real skill set, isn't it? Hussein definitely epitomised that.
Yeah. And we're still learning, aren't we? We're still putting ourselves on courses, aren't we, Ollie?
Yes,
kind of
absolutely.
upskill,
I'm
learn
doing
new
one at
stuff.
the moment, doing a pain reprocessing therapy course. It's really interesting. It's so exciting what's going on in the field of health coaching and beyond.
Yeah, indeed. And I'm doing internal family systems at the moment. So again, I'm learning about that and just, it's just another layer, isn't it, of stuff that we can get into as we progress, I think.
Yeah,
Um,
every day's a school day. Well, so this week's been
yeah.
a busy week for you, Tim, isn't it? You've been at the
Yeah.
Workplace Wellbeing, Health and Wellbeing at Work conference, haven't you? How was that?
Yeah, well, it was full on. Yeah, I went down with our operations director, Jennifer, on
Uh-huh.
Monday evening to set up a little stall. And then we're sort of all ready to be joined by some other colleagues on Tuesday and Wednesday. So we had full days Tuesday and Wednesday having conversations with people. We took our 10 components of a thinking environment hoopla so people could win a free place on one of our foundation courses and a way of kind of drawing people in, but a bit of fun. And that was quite good. Actually, some people were really quite competitive with that, revisiting the stall a number of times. I don't know how many talks they got to because they were spending quite a long time throwing hoops at our stall. But it was good. We had some really great conversations.
But it's a great conversation. So you were talking about health coaching, the potential in the workplace, and so what were the highlights of some of the conversations you came away from then?
Well, I suppose one of the things that I'm noticing is that not many people know what health coaching is
Mm.
in the workplace. And so that's kind of often the bit after we've done the hoopla, the bit of kind of conversation that we were having in terms of explaining a little bit what health coaching is about, providing an environment for people to think really well for themselves about their own health. And I suppose how it's a much more for us feeling like it's a very preventative, proactive, personalized approach, as opposed to maybe some other interventions in the workplace which seem quite reactive, whether that's your employment kind of assistance programs or whether even if it's mental health first aid, it feels like that's kind of a reactive thing. I'm nothing against those things. I think they're great, but health coaching feels like it can be reactive, but it also can be kind of proactive. It can be asking people those questions just as simple as, what are you doing to look after your health at the moment?
Mhm.
And then just seeing where you go from the answer to that question is going to give you a different type of conversation. So, and I suppose that's what we're doing that's slightly different is that we're training people or wanting to train people to have those conversations, not kind of bringing stuff in from the outside. I suppose that feels a bit different.
Yeah, so it was an interesting venture for us, wasn't it? We've mostly worked in the NHS. We've seen how health coaching is transforming the NHS and self-care of long-term conditions, what GPs and nurses do. So it's been a little bit of an extension for us, isn't it, to think, well, could this be relevant in a workplace setting as well? Can we encourage workplaces to build the culture where health coaching is the norm, if you like? And did you get
Yeah.
so it does still feel very new. And what was the reception from people when they were talking to you about health coaching in the workplace?
Yeah, well, I think once people realized what it was about and what we were trying to do, there was genuine excitement. So there were a lot of people from occupational health were there, lots of
Mm.
people who were, as you can imagine, there were people from kind of the wellbeing services of various organizations. And there were some independent kind of people working in that field as well. And I suppose all fairly interested in some people interested for developing themselves,
Yeah,
and some people interested to kind of take it back to their workplaces. So we've got a number of people to kind of follow up
yeah.
for this week. So I'm really excited about that and see where that's going to go. Um, but yes, it does feel different to what people have been having in the past. And suppose it feels like, it's a little bit early. So I suppose for some people, it might feel a little bit kind of stepping outside a bit of a comfort zone to go with this approach. But I suppose what I'm thinking, and I suppose what was coming across was
Mm.
the skills that we'll be teaching people are skills that they can transfer and use in other situations as well, whether it's in a one-to-one or whether it's in a supervision session or whether it's in a team meeting. People can use those skills alongside the other work that they do. So it feels like you're maybe investing in your line managers would be a really good thing to do anyway, and this might be a really good thing to do.
Yeah, it's interesting, isn't it? So I've heard some people say that, particularly in larger businesses now, they've been exposed to coaching, haven't they? They've had leadership coaching, they've often had team coaching. Did you get any sort of pushback about that? That well, we already do coaching. Why do we need health coaching?
Yeah, I think there's a little bit of a yeah. I mean, and I suppose some of the skills are similar, aren't they? Some of the skills are similar, but health and kind of people who are maybe pushing themselves to kind of go for promotion or having some sort of career coaching and health coaching feel different to me. And I therefore think that you need a different type of conversation.
Mm,
So again, yeah, there were people saying, well, actually, we've already got, and for some, it did feel a little bit like we've already got this sewn up. Do you know what I mean? We've
yeah,
got, we've got our mental health first aiders, we've got our health champions, we've got our EAP. We do have kind of coaching for our managers. So they're already doing that as part of their leadership management. So why do we need anything else almost? So
yeah.
there
What
was a
and
definitely
what did you say for them? How did that conversation go?
Well, for some people, you can have a conversation and maybe it's not going to go anywhere, but
Mm,
it's just sowing the seed that actually some of this stuff, we know that people don't really engage with their EAPs often with the employee assistance programs. They don't engage with them,
yeah,
maybe because they feel there's, a stigma or a worry about kind of career progression if they do engage with them. Some of them we know they just not aware of those programs.
yeah.
And I suppose what we're trying to do is embed a culture of of health coaching in the organization. So conversations about your health, not your career, but conversations about your health become business as usual. It's almost like a normal thing to have. And people don't need to feel worried about having that kind of conversation or even asking a question about someone's health. That kind of feels like a normal thing to do and a
Mm,
supportive thing to do. So yeah, I know that some managers might feel like it's overstepping a boundary, or they may feel like it's prying. And I can understand there may be things you don't want to share about your health, and I don't think we should be forcing people to do that.
no.
But wouldn't it be good if someone took the trouble to ask? Do you know what I mean? Because they're really interested in you as a whole person, not just you at work. I think that would
Mm.
be really important. Well, I don't know. What do you think?
Yeah, no, I think it's really interesting, and I think when you think about health and wellness as a whole thing, don't you? You think about people's sort of holistic health, I guess. Their of course their physical health, whether or not they're managing blood pressure and their weight and all the things we know as doctors keep you well. But then there's your mental health as well, very closely overlap. Almost can't separate the two, physical and mental health. But then that sort of emotional well-being and those sort of wider determinants of health. Whether you're feeling socially connected with people, whether you're sort of, you know, your finances and your housing and your kind of relationships are all working out. It's interesting, isn't it? Because of course, there's a limit to what people want to share. We know that as GPs, don't we? There's a limit to what people want to share openly, and confidentiality and privacy is really important to a lot of people. But I suppose it's interesting to explore whether the workplace can play more of a deliberate role in helping people to, be able to create good health and wellness for themselves. Because I guess you spend a lot of time at work, and it takes up a lot of people's energy, and it does have quite an influence on our health and well-being.
Yeah, and I suppose the other thing that came up, and this was a kind of a parallel which was kind of drawn by the people I was speaking to, was about the situation with the health service finds itself in, which is it is a very reactive service. That's where all kind of most of the kind of the money and the resources go in terms of this reactive, and actually that is probably in terms of employee health and well-being, that's where the resources go. It's into this reactive kind of
Yeah.
employee assistance programs, or which might include things like counselling and support with maybe getting some help with their physical health a little bit earlier through some private health insurance. So. And what we know in the health service is that way of working is not sustainable,
Yes,
and
that
it's
reactive way of
also
working.
yeah,
Yeah,
exactly,
yeah,
and it's
yeah,
also not going to be sustainable for our workplaces as well. So the sooner people start thinking about how can we prevent some of this ill health, I think the better. And I absolutely think health coaching is one way to do that. I'm not saying it's everything, but it's
yeah, yeah.
definitely one way to do that. How can we? I suppose the thing is, once you can get people thinking about their own health and well-being,
Mm,
and that they've got a role to play in it,
mm.
you're on the way. Do you know what I mean? But it's working with the people who feel like their health and well-being has nothing to do with them. They've got no control. They've got no agency, no way of changing anything. Um, that they're the people that we need to kind of work with, because as soon as people understand they've got a role to play, and then we can support them to take that role, I think people tend to fly with
Yeah,
it. That's
yeah.
my experience.
Yeah, and it's interesting, isn't it? Because the parallel we've seen in the health service, isn't it, is that for so long the health care professionals, if you like, really have wanted to tell people what to do, haven't they? Have wanted to sort of dictate. Look, if you just follow my advice, if you just take this medicine, if you just practice this type of exercise or whatever, and it is very power heavy towards the healthcare professionals, and driven by them, and we know that creates a degree of passivity in people. It doesn't help them to think well, as you say. And I can see that same transition in healthcare of like, well, we'll pick people up when they're ill. We'll pick them up when they've, they can have counselling if they're mentally unwell. They can, like you say, you're shutting the door after the horse is bolted. And I often sort of think of it as like, if you think of like a sort of professional football team, let's say, sort of when people are injured, they go and see the physiotherapist and they have treatment and they try and get them back on the pitch. But actually, what a lot of professional teams do, of course, is they coach their players when they're well. They coach them to perform well and to be at their optimum. And wouldn't it be great if, workplaces were able to, not only catch people when they're unwell, mental health first aiders to signpost people when you're unwell, but also to, to really try and create that culture and the conditions that help people to stay well and thrive in and out of work. Work does have such an influence on that, doesn't it?
Yeah, exactly, exactly. And I think, health coaching skills absolutely can support people to do those jobs that they're already doing, including the mental health first aid.
Yeah.
And I know, when we worked with the London Ambulance Service, they very much had a kind of a reactive kind of well-being service, and a very much a signposting service. But actually, with health coaching skills kind of layered on top, they can actually then feel quite comfortable and confident to have health and well-being conversations with people that went beyond kind of signposting. So I think that's the
Yeah,
bit
yeah.
that most excites me. I think, and I think we can. Yeah, and I know this. That Dame Carol Black said this, that if you want to, with limited resources, what you want to do is you want to invest in your line managers, because they're the people who are having the contact with the people, with their team, more often, and actually, some of them don't feel comfortable and confident to have those type of conversations. Technically, fantastic, but having the people
Yeah,
skills
yeah.
was something that she identified was something that was missing, and I think health coaching skills would be really useful for them. Having a health coach in your business would be amazing. I think.
Yeah. Well, it's been interesting, isn't it? Thinking ourselves how that might work in a business, and we've had a lot of experience over this last year, haven't we? And I'm fascinated in, like you say, the dynamic of line managers, where there is a sort of power dynamic in a degree, isn't there? You know, a line manager's got sort of say so of how people who are reporting to them behave, and they can set performance indicators and targets. But again, like that dynamic doesn't really sort of support a coaching style approach, really, does it? So I can also see the real benefit of peer-to-peer health coaching, so people on a similar level. But I'm also really interested in sort of the reverse dynamic of coaching up, so juniors perhaps giving seniors a chance to explore how their health and well-being is going. You've got much less of that power dynamic then, haven't you? And it really can be quite a sort of enabling, and it's much less intimidating. Perhaps I don't know. Is it vulnerable to admit things to your juniors, or does that create a sort of a sense of trust in a team that again enhances the whole culture of your organization? I'm fascinated to think about all the dynamics of that.
Yeah, well, we know that. I think we've both experienced that, on training that we've delivered. Certainly, and recently in the kind of the What Matters to You training that I've been delivering. Um, when we have done a live kind of session and having a What Matters to You conversation with someone, and that person chooses to share something and be vulnerable, it absolutely sets the tone for the rest of the session. And that's then other people also choose to be vulnerable. So that I think people in leadership positions showing vulnerability or willing to be vulnerable, yeah, it builds trust
It does.
in a in a in
That
a,
was
in a
one of
team. Yeah.
Yeah, wasn't that one of Lencioni's big, Patrick Lencioni and his 5 dysfunctions of team, isn't it? The absence of trust is the base layer, isn't it? And so often team leaders that can set a culture of people being prepared to talk about when things don't go well, when they've made a mistake, when they failed at something, perhaps, whatever language you want to use, actually being able to sort of, create that culture where it's okay to talk about it. You don't blame, you don't judge. Yes, you're all aimed around trying to achieve performance and you don't deliberately make mistakes, but when they do happen, you are able to deal with them in a kind of like a learning context rather than a persecutory or a sort of blame culture. Or very, very effective. So health coaching can have all sorts of sort of benefits in that system, can't they? Not only some personal skills, different conversations, but maybe it sets a new tone and culture in your organization as well.
Yeah, and I suppose the other thing that I noticed was that some of what was offered was very expert driven. Do you know what I mean? It was kind of the idea is that if we get people in who are experts,
Yeah.
whether that be in mental health, whether that be in menopause, whether that be in metabolic health, whatever, we get those people kind of into our organizations to educate everyone
Mm,
about those things. And by the way, I think that is a good thing.
mm.
But I don't think it's the thing that's going to transform the way that people look after themselves. As we know,
Yeah.
people need knowledge, absolutely, but they also need confidence and skills, and you don't get that from a 1 hour webinar or a half an hour session, or which sometimes I think can feel a little bit like a tick box exercise. We've done kind of we've crossed off mental health. We've got the kind of the menopause kind of stuff covered. We've done some work with neurodiversity, and it's almost like a tick tick tick. Whereas actually, the thing that probably makes the biggest difference is when you can get people thinking for themselves. And that's it. They
Yeah.
don't need us to download everything we know about a thing. Doesn't mean that we can't share some useful information, but
Yeah.
get downloading everything for people who are maybe already overwhelmed, already up to here. I don't think that serves anyone well,
Yeah,
really.
no, you hit the nail on the head. That keeps coming up for me and everything I'm doing in the NHS training, but in the workplace training as well. Recently, I've been did some webinars for a couple of companies recently, and a course for some senior leaders from workplaces. And that was the thing that really struck me. Actually, was that there is this sense that we're just lacking the right information. If only you've just got the magic sort of, like you say, hour-long webinar that tells you how to manage, your diet or your exercise, or how you manage stress, or how you manage your mental well-being. And it's a deficiency of just the right information, or the most up-to-date, cutting-edge stuff, maybe in an app form or maybe in a video people can watch. And it's trying to get people to appreciate that, yeah, like you say, having up-to-date knowledge, the right sort of knowledge is important, but it has to be tailored to the individual. So you can't have a generic one-size-fits-all. And it sort of has to be delivered in that health coaching style. And it's really interesting for me as a doctor, because we're almost slightly undermining the status that people, and the esteem that people hold us in. It's really interesting. It's sort of like, well, you're a GP, you've studied, you know how the body works, all the physiology and the pharmacology, you know what to prescribe, you know what to tell me what to do, but it's sort of saying, yeah, well, that is important. And, we as doctors, yeah, we're important. The knowledge we've got is important, how we tailor it to you. But actually what is really important is the person I'm working with feels, that sort of sense of self-belief and self-worth and self-confidence, and is prepared to start to engage. And I think we all underestimate that, don't we? We've been
Yeah.
underestimating that in the health system for sure. And I think that's why we've had a real success in bringing that culture into the NHS and seeing health coaches and link workers, and as Hussein talked about last week, that penny drop of how you work with the person you're working with, but it's interesting in the workplace. I think there still is the feeling that deference to the medical experts, and we don't want to bust that. Because we quite like that to some degree, but actually there's a more happy medium. I don't know. Does that make sense what I'm saying?
Oh, it absolutely makes sense. Yeah, and it's how do we wean people off that idea that that's what they need?
Yeah,
For me, there's not a lack of information out there. I
yeah,
mean, goodness, sometimes it's overwhelming amounts of information, and sometimes it's conflicting information. And maybe we definitely need people to support us to maybe navigate that. Definitely, but it's not that they haven't got information. It's that they don't feel confident and they don't feel skillful.
yeah,
I mean,
yeah,
I'll share an example. I share this
yeah,
on kind
yeah.
of some of the training that we do, but I remember when I was working as a GP, and doing triage, and you have kind of 80 people on the list, and on one of the lists it said it was someone, and it said query tonsillitis, and I thought, okay, so I rang this guy up. He was a young guy, I think he was in his kind of mid-20s, and I said, well, tell me a little bit about it. So I got this really awful sore throat. I said, well, how long have you had that? He said, well, I woke up with it. I said, well, what have you done yourself so far? He goes, well, I've rung you.
Hmm.
I'm thinking that's kind of the level. And its thing is, it's quite, oh my goodness, it's quite shocking. At the same time, I feel as a kind of a healthcare profession, we need to take some responsibility for what we have created. Not just us, by the way.
Yeah,
I think
yeah,
this has been created by successive kind of governments who kind of tell people you don't need to think about your health, you don't need to worry about it. We've got it covered with the NHS. Well, guess what? You do. If you really want to, if you really want to kind of be well into your older years, then you do need to start thinking about your health. And I think you talked about it before in terms of what we need was a kind of a totally engaged kind of population. That was kind of what came up in the report, wasn't it? That we needed that in
yeah,
order to have a sustainable system. Well, we don't have that at the moment, and it's not through a lack of information and knowledge.
yeah.
It's because people don't feel confident enough.
Yeah, no, I know. That's the thing. But I mean, and a lot of the teaching I've done, you'll often get that classic question of what's the really key bit of information? What's the golden nugget for us to be telling our workforce? You get a kind of really sort of thoughtful HR leader or chief exec, what can I do for my workforce? How can I look after them the best? And I must admit, having been asked that question lots of time, I find myself sort of thinking, it just help your employees to feel good about themselves. If they actually feel like their work has meaning, if their life has meaning, they have a strong sense of self-esteem and self-worth, they will find the information they need to look after themselves. It's when they feel overwhelmed with everything else, and work can have a big part to play in that. When you feel like you're being, you don't have a voice, you're being treated, like crap. You're not being sort of allowed to take a role. You feel undermined, you feel undervalued. All those things that just make humans feel rubbish. If you see that happening, that's a health and wellness that's a health and wellness issue.
Yeah.
it's and it's all
Yeah.
tied up together, isn't it? Because you of course, if your health and wellness is good, if you're flourishing, then actually your productivity is always better and your performance at work will be better. So they're intimately linked. But it's being able to just step out and say, this is a key area that I need to think about. Does this person feel good about themselves? I think that's a key feature for people.
Yeah, and how do you make people feel good about themselves? Well, you take some time
Oh,
to
you just tell them
understand
they
what.
should do, don't you? You just tell them you ought to feel good about yourself. Why don't you feel good about yourself?
Yeah, you send them on a 1 hour lunchtime webinar on how to feel good about yourself. Yeah,
Yeah.
it's not it's the time, isn't it, to take to kind of slow down, take a step back, and just ask people, what's really important to you at the moment, what really matters.
Yeah.
Because actually, what people get bombarded with sometimes is a whole load of stuff that is just not where they are in their kind of headspace. So
Yeah,
actually, it's just almost like it's a waste of time because it almost like it just goes over people's heads because they. And what was someone told me the other day? It's almost like they have this knowledge shield almost. So you can
Mm.
you can download a whole load of stuff, but actually, if people are already up to here, if they're
Yeah,
already
yeah.
overwhelmed, then actually it doesn't matter what you've got to tell them. They'll have this knowledge shield that will go up. It's like, well, I haven't got any capacity for that. So again, you can run as many webinars as you want. It's not going to make any difference. What we
No,
need to do is take some time, take some interest in the people that we're working with, and ask them what matters to you, which I know I'm going to be talking to the wonderful Alanthi Fowler for one of the other future kind of
oh, that's coming
episodes,
up
which I'm
soon,
really
isn't it?
looking forward to. Yeah. And again, some of the teaching we're doing on that kind of what matters to you conversation, how to have that conversation, which seems so basic,
Yeah,
but
yeah, yeah.
actually I think we rush it and I think we don't get into it um, because we're so interested in telling people stuff so that they'll be able to use what we know to kind of be healthier. But this
Yeah,
and I
yeah,
think
yeah.
probably Hussein kind of alluded to that in that last podcast. That actually that's not the thing.
Yeah.
It's actually the coaching is the key. I think.
Yeah, no, absolutely. And I'm minded of being with Sheffield United Community Foundation. They're a great organisation, obviously a great team. But you're seeing more and more of the football clubs. In fact, Charlie Mayfield's report talks about this, isn't it? About
Yeah.
using the assets that are in the communities. A lot of the English Football League clubs now have community foundations. So 30 of them together, they have all sorts of sort of education programs, young people sort of, trying to build their employability and their kind of like assets and skills and their confidence really. And the people that are working in the community level often know how to do this really well. And it was interesting. Someone asked me a question from that group and just sort of said, well, we see so many kids with low self-esteem and, what do you, how do you build their self-esteem? And I sort of said, well, what are you doing already? And it was just brilliant. This lady sort of said, well, we just find something that they can do. And we encourage them just to sort of start tiny. We just find something that makes them tick. We try not to load them up with things they ought to do or new stuff that they have to do. We just work from what they're already got an interest in and what they're already good at. I just thought that's brilliant, absolutely brilliant. You kind of know this already. It's almost like people need permission to value that as much as all the kind of technical stuff and all the kind of like, apps and, the kind of quick win, quick fix stuff. No, it's all about hearing people, letting them talk, letting them experiment with stuff and helping them to feel good.
Yeah, so correct me if I'm wrong then. So those people that I mean, and that person you spoke about there, they've not been on any formal kind of coaching training, and yet the way they're working seems very much aligned with that.
Yeah, it's intuitive, I think. I think people sort of know that, you can tell when people are feeling battered and overwhelmed, can't you? And you can tell what starts to kind of get people, just standing up a bit taller and just starting to feel a bit better about themselves, because that's the starting point, isn't it? We always talk about that hierarchy of health coaching, don't we? You want to get up to where people are, covering those wider determinants of health and the kind of like the lifestyle pillars, lifestyle medicine pillars, and then getting up to looking after their blood pressure and their diabetes, doing all the things that the doctors and nurses tell. But at the baseline, if you don't feel good about yourself, if you don't have a sense of self-worth, you haven't got anything to build on. And it probably, just like trying to build a house on sand, it'll just fall away. So that foundation of your sense of self-worth is it's just so important. And, again, I think it's where workplaces can help people, to achieve that in whatever way matters them or whatever feels meaningful to them.
Yeah. And I'm wondering whether, there will be people who are absolutely already working in this way,
Yeah, yeah,
like that person. And actually, and a bit like when I came across coaching, and maybe for you too, that when you know what it is and you have a framework to work in, the kind of the way that you've been working, you can do it even more deliberately, even more consciously and more skillfully and get more consistent
yeah,
results. Whereas before I think I had the coaching as a framework, I think I was sometimes having some great conversations, sometimes not at all. And I wasn't able to kind of work out what was going on. But I think now I'm familiar with the concept of activation, people's confidence, knowledge, and skills, and having a coaching framework. I think that's allowed me to just be more deliberate and more skillful with the way that I have those conversations, I think.
Yeah, you hit the nail on the head there. I think it is that sort of tailoring aspect, isn't it? Is that, being savvy enough as a line manager or as a peer support or, as a health coach in an NHS or workplace to be able to listen and understand what sort of support people need right now, and crucially what they don't need. That's the thing, isn't it? It releases you from saying, well, they're not ready for this bit, they're not ready for that. What I have to do now is just help them kind of find their footing, and having the confidence that that is an important step to take, and that you will overwhelm people if you try and go too quickly. I think that's a real key of learning health coaching properly, isn't it? I know it's something that we both think's important.
Yeah, yeah. And I think we can definitely train people in those skills so they can use it alongside and within the work they're doing, whether a line manager or whatever role they have, or, maybe even someone more junior, as you were saying. But I mean, thinking kind of even just the economics of it as well, it's that plus, if you had, you know, within your organization, a health coach, maybe as part of your occupational health team, I think that would be just phenomenal in terms of the amount of time that they would have. Would have more time than a line manager, for instance,
Yeah, yeah.
to spend with people. My sense is that's going to be a huge return for
Yeah, it'd be
organizations.
cool, wouldn't it? And it's interesting to know whether that would be an external person, like sort of for a bit of
Mm,
privacy and for sort of like to, or
yes.
whether it's an internal person. And I can see the pros and cons of both. Someone internally understands the office dynamics. They understand that they have a bit of insight into sort of some of the challenges of the workplace, don't they, and the pressures of the workplace. But maybe people are a little bit nervous about that privacy bit and confiding in people who are too close. So I can see both parts playing out. But and I could also see the benefit of just making sure that everybody to some degree has an understanding of how to have a conversation and the value of it, and yeah, it like you say, builds that culture, doesn't it? Yeah, it's really really interesting
Yeah.
time. I must admit, I'm really excited that you said that people hadn't really heard much about health coaching at the workplace conference, because that it does smack of a lot of potential to me. There's a lot, we've got a lot of work to do there, Tim. Huh?
Yeah, I think we've got lot of work to do, and we need to be we need to be patient. I am quietly confident that this, I mean, it absolutely feels like the right thing. And again, I don't, we're not the only people in this space who can do this kind of work, but I feel like it's yeah, I think it's really important. It feels like, and a bit like, having health coaches in the NHS where they're kind of being much more proactive and preventative, and having those opportunities to kind of work with groups. I think the same thing absolutely could happen in workplaces. And maybe workplaces are even a better place for health coaches to be. Maybe.
Yeah, it's sort of a mixed economy, isn't it? I mean, we're as GPs, I think we know, don't we, that most of health doesn't actually happen in the consulting room or in the GP surgery or the hospital ward. Sure, maybe when people are really stuck, maybe in an emergency, but most of looking after yourself just happens day to day at home with your friends, but also a lot in the workplace. The workplace is such a crucial setting for whether or not you feel good and you feel healthy and well, and whether or not you're able to think well, like you say, and pursue actions that are going to, just give you more energy, more zest for life, more just make you feel better about yourself. And at the end of the day, I think that is key, isn't it?
Yeah. So I'm excited. It was
Oh,
great to have so many conversations with folks, and again share a little bit about health coaching and
yeah.
hear their and well also taking time to hear their perspectives and hear where they were coming from, and hear what was currently on offer. So I'm excited, and I'm hoping we're going to have some more conversations with the people that we made contact with,
Yeah, yeah.
because I think that was that feels like it's early days, but I think this is absolutely the right place to be.
Yeah, it could sit alongside the NHS, can't it? I mean, the NHS can't do everything for health, as we say. So actually, if workplaces are becoming more involved, it's going to benefit everybody. And in fact, that does seem to be a big direction for the DWP, and the Charlie Mayfield report that came around, sort of helping keeping, the health of the workforce so crucial for the kind of economy and productivity of the country. Keep getting people into work that works for them, That's just so important. And in
Um,
fact, we couldn't
yeah.
stop this, but without thinking about our conference as well, Tim. You know, we feel this is so important that we're dedicating our annual conference. Well, not all of it, but there's a theme, isn't there, around how we look after the workforce, whether they're NHS employees or whether they're businesses, and how we build these skill sets into what's happening in workplaces to create good health and wellbeing in the workplace.
Yeah, so Health Coaching for Healthy Working Lives. That's the title.
Yes.
And it's on the 6th of May. I'm going to just check, I'm looking at your
Yep.
face and you're in
Wednesday,
agreement
6th
with
of
me.
May, absolutely, in the beautiful Sheffield.
Yeah, so really easy to kind of get to. So again, wherever people are listening to this in the country, very easy to get to that.
Yeah.
And it's always a real buzz, isn't it? Those
Yeah,
those
yeah, it
those
is great.
days. So I'm really looking forward to it. And again, there'll be some of the usual suspects. We will talk about pain management because that's our area of
Yep,
interest, and
yep.
we know it's going to be increasingly important. I think we are going to be talking again very specifically about kind of mental health in the workplace as well.
Yep, completely. So there'll be a theme around the workplace, but of course it will draw in all the health coaching sort of skill sets. I'm really excited about hopefully having a few sort of businesses with a leaning towards workplace wellbeing and, as you say, HR and occupational health, but then also a lot of the NHS coaches we know who, it's the fourth year we've been doing it, isn't it? We know there's a buzz. We know how much people enjoy connecting and meeting people who they might have seen on courses or trained with, or they're just sharing ideas. And I can see a lot of health coaches now in the NHS are also providing health coaching for staff internally as well. I've seen lots of that happening across the country. So it feels like sort of almost different worlds meshing together, I hope.
Yeah, and then again, there'll be a lot of learning from each other. And I'm particularly excited about this year's conference. So yeah,
It'd be
and
good.
there's still tickets. There's still tickets, Ollie. I think.
There's still some left. We're what, so 7 weeks to go now. Yep, we're not sold out. We usually sort of sell out with a couple of weeks to go, is this usual sort of pattern, isn't it? But now is the time to get in, because after this there'll obviously be a flurry. And we have got a really good keynote speaker. Really delighted, Jeff McDonald, who was the global HR lead for Unilever, a huge company, so massive experience. And since he left Unilever, he's been consulting around workplace wellness, particularly around mental health. He talks about the energy of your workforce being just an essential ingredient. It's like a sort of almost the essential ingredient of whether a company succeeds or not is the health and wellness of its people, whether that's in the C-suite or whether it's the sort of staff or whatever size your organization. If your team doesn't feel good about themselves, you're probably not going to get anywhere, really. So I'm really looking forward to hearing how Jeff opens up the day for us.
Yeah, it's going to be great. It's going to be great. Now, I'm just conscious of time, Ollie. Is
Yeah,
there anything more we want to share? Is there anything more we want to share before we close off today?
there could always be more to share, Tim, but I think that's enough for now, don't you?
Yeah. Okay. Well, go well, folks.